My name is Paul Rutkowski. I'm an orthopedic hand surgeon at Genesis Healthcare System. My education began in St. Louis, Missouri. I did 4 years of undergraduate there, and then I went to Wright State University in Dayton, Ohio for medical school, and I did my orthopedic training, my orthopedic residency at Mount Carmel in Columbus, Ohio. And then my last year of training was in hand and upper extremity surgery in Memphis, Tennessee at the Campbell Clinic. I decided pretty early on in my medical training that orthopedic surgery was what I wanted to pursue. It's a fairly competitive specialty, so there's never any guarantee you can become or you can match into this residency. But throughout residency, I enjoyed almost every part of orthopedics, and the hand in particular was the most complex, and hand surgeons have the opportunity to do surgery on all parts of the hand: bones, tendons, skin. And I wanted something that would be challenging and enjoyable as a career. I think there's a lot of excitement in hand surgery. We operate on large bones. We also operate on small nerves and vessels. We do microscopic surgery, and when we're not using the microscope, almost all the surgery is done under some sort of magnification, usually in the form of special glasses that we wear. And the level of detail that we can see and work on is something that we don't do in other parts of orthopedics. And that was something that I always loved throughout training. Having done all of my medical training in Ohio, my wife and I became very comfortable here, and we always imagined we would come back for work. So in fellowship and throughout residency, I was fortunate to have mentors who were very focused on patient first care and taking care of patients above everything else. And so that was a priority for me, and that seems to match up really well with the mission here at Genesis, and that's what drew me here to this job. Most common surgeries I do are carpal tunnel release, trigger finger release, and fracture care of the hand and wrist. I also take care of really all problems from the fingertip through the elbow. I like to know as much as I can about my patients. I often know why they're coming to see me because it's on their chart, but I like to know what their hobbies are, what they enjoy doing, and the things that make life fun for them. One of the other reasons why I chose to do hand surgery is that we interact with the world mostly through our hands, or at least a lot with our hands. And so getting to know how we can improve someone's life by doing hand surgery or treating problems with their hands is really important to me. The most rewarding part about what I do is seeing patients back after surgery or after any sort of treatment, and seeing them better and being happy and being able to do the things they love to do. Outside of work, I enjoy spending time with my family, my wife and our 3-year-old son. We do a lot of things on the weekend with him. Saturday is a Buckeye football day. I'm also a big fan of the Columbus Blue Jackets.